I'm Dr. John Kruse, and today I'm going to be talking about transgender health from 2000 to 2025. This is a general mental health topic, and as usual, I'll start with the take-home message. So the take-home is that transgender individuals are far more visible than they were 25 years ago. They are far more accepted in society than they were 25 years ago, but also engendered extensive negative feedback from those opposed to transgender rights. And despite claims to the contrary, there's actually a sizable, fairly consistent body of research on transgender affirming care that confirms that many benefit from it. Disclaimer before I jump into the rest of this, I am a gay man. I have family members in the LGBTQ community. And number two, this will address politics will be talked about in this discussion because they are inextricably linked with public and mental health aspects of transgender care right now in this country. In the year 2000, less than 1% and maybe closer to 0.1% of individuals identified on surveys as transgender. And any reports in the media treated this as a sporadic, rare, deviant human condition. We're in a dramatically different place in 2025 when 15 to 20% of the younger generation identify as somewhere on the LGBTQ spectrum. We'll get into that in a little bit. Rates of identifying as transgender or anywhere on the LGBTQ spectrum have risen considerably, but particularly among the younger age groups. And there's been reported numerous court cases, legal battles regarding transgender athletes, regarding bathroom use, dependent on gender, use of pronouns. Some of these cases, the Tennessee restrictions against transgender care have reached the level of the Supreme Court. We're still waiting on a decision about that. And in the 2024 elections, more than $40 million was spent on anti-trans ads. The first trans member of Congress, Delaware's Sarah McBride, was elected to Congress. So there's definitely been a movement towards, again, greater visibility and acceptance, although it's certainly not complete acceptance. Whether you view that as progress or rejection of traditional values is an opinion, but this does not mean that everything on this topic is just an opinion. It's just he said, she said, or they said. There's, again, actually a considerable body of evidence, scientific evidence. But before we jump into the evidence or talking about that, I want to define some of the terms because defining terms is important for any discussion. And secondly, because the terms are actually being intentionally blurred and misused and distorted by those opposed to those rights. Third thing when I say I'm defining terms is that these are my understandings of what conventional current understanding of these terms mean. It's not meant to infringe on anyone's right to use the terms in ways that better suit them. And there should also be an acknowledgement that language changes over time. So starting with the basic difference between sex and gender. So sex is defined as biological conditions, whether it's chromosomes, hormones, genitalia, secondary sex traits that biologically identify someone as male, female, or otherwise, whereas gender is tied to a social construct. It's how you identify as an individual, as male, female, or others. And sexual orientation is a separate dimension from gender or sex, refers to what type of individuals you are sexually interested in. And every combination of sexual orientation with gender is possible. Transgender individuals are defined as those people who identify differently from the gender they were assigned at birth, whereas cisgender people are those who continue during life to be identifying as the same gender they were identified with at birth. The term non-binary is a broader term, and it means people who consider that the male-female dichotomy does not fit them. Now, that can include trans individuals, but some trans individuals are firmly wedded to a binary. The other important thing, and this is one of the things that is blurred by opponents of trans rights, is sort of implying that everyone identifying is actually, or desiring to be, is transgender and is desiring to change their gender with surgical intervention. It's pretty clear that only a tiny part of the spectrum of the LGBTQ spectrum, most surveys in most recent years indicate that it's still only about 1% of the population at large identifies as trans. That is slightly higher in the 1 to 2% range for the youngest generations. And again, rates of identifying anywhere on the LGBTQ spectrum have increased substantially over the last 25 years. One additional term, and I only hear people of my boomer generation or older continuing to use it or misuse it, and that's the term transsexual, referred to what we now call cross-dressing. So that is individuals who are intentionally wearing clothes that are different from their gender identity. Drag has become much more prominent part of our culture. The RuPaul's Drag Race is one of the biggest audiences on television. But there's no implication of sexual orientation or gender identity among transsexual. Again, that's not a term we use anymore, cross-dressing. So jumping back into our time capsule a little bit, where were things in 2000? So before 2000, the first awareness many Americans had of the existence of trans individuals was Christine Jorgensen. She was a singer-actress in the 1950s. She came out publicly with her memoir in 1967 about traveling to Denmark to have surgery. There were a few other prominent books in the 70s, 80s, 90s. So Jan Morrison, who was a travel writer, well-respected one, wrote Conundrum in 1974 about her journey. Renee Richards, who was a ophthalmologist and a tennis player who changed gender appearance, still playing tennis, and fought legally to compete in national competition as a woman. And those cases went all the way up to the Supreme Court, affirming her right to do so. Second Serve was her book that came out in 1983. Other media in the movie, Hollywood, there were movies like Myra Breckinridge, which featured transgender characters, but usually it was clearly in a sordid, titillating framework, or other movies like The Crying Game, spoiler alert here, where a key character came out or was revealed to be transgender, and this was done largely for shock or surprise value. So bring us to the turn of the millennium. Boys Don't Cry, a 1999 movie in which Hilary Swank played the real-life character Brandon Teena, is often credited as one of the first few nuanced portrayals in the popular media of showing a transgender character as a fully human being and an empathetic one. Even though Hilary Swank won the 1999 Academy Award Best Actress, there was extensive rumor or concern that this was going to ruin her career. This was too provocative. This was too out of the mainstream. And in the medical approach to treating transgender individuals, in 1978, there was a physician, Harry Benjamin, who spent most of his career working on transgender health issues. He formed an organization for the care of transgender individuals. And for years, the guidelines from this group were the standard of care for treating transgender individuals. And those guidelines first came out in 1978. Still in the year 2000, there was not widespread awareness, visibility, or acceptance of trans people throughout medicine. So the first trans patient I had, I began meeting with, I'll just refer to them as W, in the late 1990s. They were a 35-year-old small business owner who came in for anger management, depression, and extreme social isolation. Their only hobby was bear hunting. They felt miserable in their life. They were abusing pain medications, and it took more than a year and a half in therapy before they were able to reveal any inkling that they were at home dressing as a woman, that they had felt all their life to be a woman, and that they were actually occasionally now hanging out with trans prostitutes in San Francisco's Tenderloin Zone. When they came out in this way, I was aware that even in the gay mecca of San Francisco, even though I was trained in San Francisco at one of the most open, liberal psychiatry training programs, there had been no mention of working with trans patients at all. I had to search for a mentor. And again, even in the gay community or the larger community, there were extremely few individuals in San Francisco and the turn of the millennium who were working openly with transgender patients. I did find one. She was very helpful in helping me help W coming out their family, cross-dressing at work, and revealing their identity to their employees, and guiding them to find support groups outside of the individuals they were hanging out with, and to start undergoing laser hair treatments, hair reduction treatments, facial shaving, other feminizing surgeries that W began on their journey. So not only was I backwards or ignorant in the year 2000, but even professional organizations that should have known better. So one of my examples is there's a subset of the American Psychiatric Association called the AGLP or used to be called Association of Gay and Lesbian Psychiatrists. In the year 2000, 2 members who were openly trans had applied to the AGLP to change its name, to broaden it, to include transgender issues. And the group felt it was a big enough change that it was important to hold a vote on this. And the vote actually was extremely close. It came down to just 1 or 2 votes before it was finally approved. The resistance to it was the claim that transgender, again, is dealing with gender identity, and AGLP was about sexual orientation. This was a completely different group. They shouldn't be blurred or mixed. All of those who were opposing the inclusion were older white men, and most of them had fought for years to get any approval or recognition of gay rights, gay individuals in the medical profession, in the psychiatric profession, and they very clearly felt that association with transsexual individuals would be a step backwards because people would view them again as deviant, strange, bizarre, unacceptable. The argument from largely the younger generation, which did win out, but again by just a vote or 2, was that yes, gender identity and sexual orientation are 2 different things, but the reason for the existence of the AGLP itself was because mainstream medicine and mainstream society rejected anyone on the LGBTQ spectrum as queer or different because of issues regarding to sex, and that put the T firmly in the LGBT spectrum. So it wasn't just psychiatry that had its hang-ups and backwardness in 2000. The biggest gay rights organization in the country, Human Rights Organization or Human Rights Commission, HRC, in the very first years of the millennium was widely castigated by supporters of trans rights because the HRC was fighting for ENDA, Employment Non-Discrimination Act, and they proposed a version of ENDA that did not include any rights for gender identity. They were fighting just for sexual orientation. Their claim was they couldn't convince wavering senators to vote for it in support of gender identity. The early attempts actually, even with the modified version, didn't go through. It wasn't until 2013 that HRC and other groups convinced Congress to pass an ENDA. And in that 2013 version, it did finally include both gender identity and sexual orientation. So now that brings us to 2025, and you can go into many areas, urban and rural, more common in urban, where you see a variety of haircuts and colors, clothes, body shapes, piercings, tattoos, body modifications that you would not have seen 25 years ago. More predominantly, you see them among the young, but they're of all ages. And again, 20 to 22% of Gen Z identifies themselves as somewhere on the LGBTQ non-binary. But again, most recent surveys suggest at most 1 or 2% of those individuals are identifying as trans. And a recent study indicated that less than 0.1% of teenagers were undergoing any processes of gender reassignment. These are changes, and I'll get to that in a moment, but to claim that this is a substantial component of youth today is just ridiculous. 25 years ago, the people who were presenting themselves for any treatment in the transgender community were predominantly assigned male at birth and identifying as female. We used to call male to female. In the current era, what's the preponderance, and it's a substantial preponderance, is people assigned female at birth who are now identifying as some gender other than female. But some of that hides that both the groups have increased substantially. So both the number of males assigned at birth and females assigned at birth are feeling uncomfortable with those assigned genders. 25 years ago, the majority of individuals who, again, were seeking treatment were individuals who actually wanted to pass for the gender that they identified with, and many of them sought surgery or hormone treatment or others with the intention of passing. Now there's a much broader diversity as to what is the desired outcome, or what's the desired presentation, or what someone is seeking or searching for. And the other big change in the last 25 years is the rise of gender clinics specifically designed to support the mental health and physical health of transgender individuals. And the vast majority of what they are doing is education, support, mental health, treating adjacent conditions. So we know rates of depression, anxiety, PTSD, substance abuse are all higher in this community. And many of them do also either provide access to or arrange access to hormonal treatments and surgery that helps with gender reassignment. But those last three medicalized categories in any clinic that I've seen statistics for a minority of the services they are providing. Tied to that is sort of the misidentification by the enemies that gender affirming means that everyone who comes to these clinics is being forced or coerced to change their gender. And gender affirming means that we are willing to meet you wherever you identify your gender being. And if you need help or assistance trying to alter part of that, then we will help evaluate what is the reasons, rationale, feelings behind that, and if it seems appropriate, then to move forward. As a backlash to this increased visibility, and many claim that it is purely a distraction, there's other bigger issues going on. At least 26 states in the United States have passed laws expressly forbidding transgender hormonal or surgical treatment for minors. Many of those laws are including people beyond minors as well. Tennessee's laws have actually been argued before the Supreme Court in 2024. There'll be a decision on that before court term ends in June of 2025 this year. And one of the claims being promulgated by many of these state laws, which directly and explicitly copy from each other, is that there's no science behind transgender treatment, that this is all mutilation, this is experimentation. This is not just a U.S. phenomenon, this is happening across Western countries at least. In the UK and Great Britain, this was such a political and public health issue because the resources, the demands on gender clinics have increased far greater than the resources available are there. The times people have to wait for any treatment have increased. So the UK Public Health Service commissioned a report. It was led by pediatrician Hilary Cass, who did a wide-based survey and investigation. She was very inclusive, including strong proponents and antagonists of any gender-affirming clinics, and came up with a report. I will oversimplify it here, but her claim was that the data is really weak for affirmative care. Lots of these kids have multiple health issues, and specifically the question why such a high proportion of those who actually took puberty blockers to delay a decision, give time to make a choice, actually extremely high percentage went on to sex reassignment surgery, and this was considered maybe alarming or dangerous. Many critics have posted scientific and political objections to her conclusions. Most of what she's saying is we should be careful, we should look at other causes, we should treat other things that are there. But the overall tone, I think, is both dismissive and oversimplifying what even science is about. So science is always a process of accretion, of building on what's already there, and for a relatively new field to object to that we don't have extensive data, and particularly that we don't have long-term outcome data, is an impossibility at the early stages. Commentary on how science in this field has grown. In the year 2000, according to PubMed, and just looking under a search term transgender, only 46 total articles have been published by the year 2000. As of 2025, more than 16,000 scientific articles have been published on transgender care, covering a broad range of issues, almost 3,000 of those in the last year alone. Some of those are about the discrimination transgender people face. Some of those are about mental health issues and comorbid conditions, what hormone strategies, which chemical formulas seem to be most effective for delaying puberty, and different reviews, articles on surgical intervention. And it should be pointed out, can include facial genderizing or masculinizing surgeries. It can include top surgery. It can include genital surgery. So just pretending there's one surgery or one plan or one route is not valid. So what do we know from science? The claim is that transgender is not natural, and you may distort the meaning of natural to fit your own definition in a circular way. But if natural means occurring in nature, and this was extensively documented by Joan Roughgarden in her book about 20 years ago, we find transgender, we find intersex, we find same-sex attraction across species throughout nature. Every human society that's been looked at, we find examples of trans, we find examples of LGBT, we find examples of non-conforming gender identities and behaviors. And these are not just introduced by Western society infiltration. I mean, it's actually interesting that many societies have dealt in a more welcoming way. Many of the North American indigenous populations celebrated two-spirit individuals. So the claim that this is not natural and it's just simply there is a gender binary and everyone is male or female is just blatantly untrue. If we're using natural mean common, that's a different thing, but that's not what natural normally means. Transgender is natural, gay is natural, lesbian is natural, intersex is natural. They occur in nature. In humans, they occur in other species. 2 is human identity. There's a lot we don't know about human identity. So if you ask any cis person, when did you choose to be male? When did you choose to be female? When did you choose to be something else? One is, for many, it sort of opens their eyes a little bit and thinks, oh, I never even really had to choose that. I just felt that. Antagonists of this frame this as a choice, but the individuals I have not heard or seen report of any transgender individual who said, oh, I just decided to choose to be a different gender than I was assigned at birth. Choice is in whether they are acknowledging this feeling to themselves, whether they're acknowledging it to the world, and whether to what degree they are willing to share or express it out in the world. That's where choice falls. All the evidence is that this is not about choice. This is a reflection of someone's deepest nature and identity. And the Cass report concluded that we don't really know what are the contributors to human gender identity, that there are almost certainly biological factors, there's psychological factors, there's social factors that contribute. But again, it highlights what puts I in identity. How do I know who I am? How do I even know that I'm a human? I mean, we looked at Konrad Lorenz decades ago won a Nobel Prize for his works on ducklings being imprinted. Ducklings don't know what species they are, and they adopt their identity of what species they are depending on what they see in the first few hours of life. How does a cowbird know what it is? They're called brood parasites. They're laid in the eggs of other species. Cowbird may be growing up among yellow warblers, but somehow it knows or learns that it is a cowbird and finds other cowbirds to mate with, reproduce cowbirds down the line. How does a sea turtle know that it's a sea turtle? Its egg is born on a little beach months after it's laid there. It has no adult turtles nearby to look at. How does it ever know? So we have very little idea what factors really go into shaping identity, whether that's a cis identity or a trans identity. Why has there been an increase in both trans identity and the whole LGBT identity? Clearly, some of it is due to social factors, that there is more acceptance, even though there is considerable pushback. Again, not just laws and blatant discrimination and screaming, but murder. People are still murdered in America because they are gender nonconforming. But there is clearly greater acknowledgement, greater comfort, greater awareness. That is clearly allowed more people to be out in expressing who they are. Whether that actually has changed the actual rates of these phenomena is unclear. There's some suggestive evidence that the actual occurrence has increased, but is that all because of social factors? One other claim is that, particularly in liberal cities, but that schools, clinics, democratic areas are indoctrinating kids to be LGBTQ, and that this is a uniform, unrelenting pressure on our youth. That framing of it is clearly, blatantly untrue. It's a lie. Is there more permission? The stance is much more, you can be whatever gender you feel like. That is permission. That is not relentless pressure. If you claim that the pressure is relentless, then all I need to do is find one exception as a counterexample to prove it isn't. So here's my counterexample. In San Francisco, by most acclaim, the most gay-friendly, LGBT-friendly city in the country, in private schools, which are supposed to be the enclave of this elite liberal attitude forcing kids to be LGBT. I have been there at the award ceremony where a principal misgendered a student not once, but at least 15 times during an award ceremony, which lasted just 2-3 minutes, his speech. Furthermore, and almost comically, the parent who's complained about this incident, in relating this incident, misgendered their own kid. Misgendering people is what we call a microaggression. I object to the term because micro emphasizes it as trivial or simply tiny and dismissible. I describe it as better as ubi aggros for ubiquitous aggression. These are attacks. That's delivering the message that who you are, how you are presenting yourself is unacceptable. It may not be explicit, but part of it is that ideas of gender are so entrenched, particularly in my boomer generation and older individuals, that it's very hard to find a place in society that consists or has our generation or older in it that isn't saturated with views that are not completely open or friendly or approving of non-binary identities. Separate from the social factors, there have been claims that biological factors may be at play. So most of the surge in transgender identities has happened after starting around 2005, in the years between 2005, 2010. But years before that, endocrinologists were pointing out that there are widespread plastic-based and other chemical contaminants in our world, Many of these are identified as endocrine disruptors, that these certainly could have the potential to increase rates of sexual identity. They clearly can change our genitals, physical presentations, but there has not been any clear definitive link that this is what is going on or driving any part of it. It's speculation. Other myths are what is known or not known. So one of the claims, or the biggest worries expressed in the Cass report and by others, is that the intent of puberty blockers are to buy these kids time. So this is for pre-pubertal kids who are considering, and to get them time to reconsider or think whether they really want to transition. Puberty blockers are a hormonal intervention. This is not a trivial step. Clinics do not treat this as trivial. It's not just there to give people time. People who start puberty blockers are carefully vetted and screened. And these are the individuals who have expressed, described, and conveyed their strong sense of identity is being transgender. Intent of puberty blockers is to prevent the development of what these individuals would be horrifying secondary sex traits. So patterns of hair development, changes in voice, changes in bony structure, brow ridges, other height changes, breast growth, genital growth, that would be anathema, that would be horrifying to a trans individual. They are not primarily buying time tools. They're not intended to, and it's actually a sign of excellent vetting of the process. Most of the people who do undergo puberty blockers do go on to further steps in gender reassignment, vetted carefully, and it's only a very small percentage. And again, the data suggests that it's less than 0.1% of teenagers at this very day and time who are undergoing these treatments. Some of these laws still allow exceptions for not people who are changing because of how they identify, but because of clear physiologic, either genetic, chromosomal, hormonal, or abnormalities. So these drugs do have an extensive track record. Another complaint or problem or issue that's raised, and it's very prominently, is the issue of detransitioning. So there are certainly some individuals who go through this process in teenage years and then regret it. And then a few of them have tried to detransition. Antagonists of gender rights actively are recruiting and extensively looking for such individuals and promoting them. There have been only a handful. Most surveys from clinics suggest that the rate of detransitioning is 1%. We shouldn't ignore those individuals. Some of those have tragic stories. Some of them did receive poor or shoddy treatment. But to present that as representative that the whole system is failing or faulty is just wrong. And again, despite very aggressive efforts, we're not finding more than a 1% rate of detransitioning. So actually, if you look at studies, and several clinics have studies done on their whole population who have gone through transitioning procedures, and the satisfaction rate is in the 80 to 90% range. And you could say, oh, that means 10 to 20% aren't happy, but unhappy can mean a variety of things. If we look at knee replacement surgery, 800,000 knee replacements are done in the US each year. Functional and pain satisfaction are comparable or lower than what we see with transition. Anecdotes make really bad public policy. They are really effective swaying opinion. My dad in the year 2000 had a heart valve treatment surgery at the Cleveland Clinic. It is an international center for cardiac care. Saudi princes go there, billionaires from the world. My dad had complications, clearly complications. Precipitant was that the doctors did not listen to him or pay attention to his complaints. Short story is he wound up in the ICU for 5 months before dying because of poor care. Now, if this were a transgender case, that would, by the critics, claim we should shut down the whole program and we should actually stop all heart valve surgeries because clearly there are bad outcomes. We didn't do that because people realize any process, any procedure, there will be some that don't work well. From a public health point of view, you need to look at what the outcomes are. Now, if there are considerable percentages, should each bad outcome be investigated in terms of what went wrong, what could be done better? Yes. But does that mean we should throw out the whole system or reject it? No. That's just silly. Multiple studies have shown that anti-LGBTQ legislation increases rates of mental health problems, increases rates of depression, anxiety, substance abuse, suicide. These laws right now are killing people. Political analysis of the last election revealed that for late deciding voters, one of the top 3 factors in their decision was stances about gender identity, trans rights, and particularly an ad proclaimed widely that Kamala Harris supports inmates receiving sexual reassignment surgery. Less than 230,000 votes in the states of Wisconsin, Pennsylvania, Michigan decided the election. That's less than 0.15% of the election. If Harris had gotten those votes, she would have won the Electoral College. She would be president right now. This issue was big enough to decide the election, and the ridiculousness of the claims. And I would say, if you have a true and valid case, you don't need to resort to lies. So, number one, she has proclaimed support for this right, but it's not an issue she proposed as legislation. It's not an issue she has ever voted on. Federal policy right now, Department of Justice policy, is that, yes, federal inmates do have a right to sexual reassignment surgery. This right was developed under the Rape Protection Act of 2008 and subsequent legal decisions around it. That was a law proposed by the Bush administration. It was passed unanimously, both parties, unanimously by Congress. This was federal policy for all 4 years under President Donald Trump. He did nothing to change it. So now to be campaigning on a policy that existed under his administration is at the very least deceptive, if not blatant lies. Other things that are concerning. Lots of lawsuits, lots of claims. According to the president of the NCAA, less than 10 athletes out of more than 500,000 collegiate athletes are identified as transgender. Is this overthrowing, overruling, disrupting women's sports? It's disrupting women's sports, but it's not the number of individuals who are competing or the size of it. Most sports organizations have established rules, for example, that a male identified at birth who is now competing as a woman has to go through at least a year of testosterone suppression. To me, it makes sense that individual sports come up with their rules. These rules have been in place and work. What's surprising is how many women, born women, cis-identified, have been accused of being trans when they're not. Again, if you have truth on your side, you don't need to resort to lies. Have a strong, valid case. There have been reported claims of injuries from the greater strength or abilities of these trans athletes. None of those have been documented, or most of them are refuted on investigation, venturing into opinion, not just facts. So, yes, I think we should try to be fair to women, but we should also be trying to be fair to competitive opportunities for trans athletes. And again, the numbers are so small that to say we should just have a trans volleyball tournament or competition, I don't know if there would be enough individuals to fill out a team there. If we're trying to move to the area, and explicitly many of these claims have, that we should be limiting people from competition because they have a physical advantage, that's just a bizarre and, I'd say, frankly, idiotic claim or stance. Because should we be eliminating tall basketball players? Should Tom Brady or Stephen Curry or other athletes be eliminated from being able to compete in their sport because they have some advantage of being faster or stronger or more coordinated or greater endurance or ability to work hard than their opponents? Just makes no sense. In terms of the issue of forcing schools to out kids, my response to that is, if you're worried about your kid, improve communication and talking with them so you know what's going on with your kid's life. If you are having that much trouble communicating with your own kid, don't think a solution to it is to force all schools out all kids who have identified as trans or LGBTQ in school when they're not comfortable doing it at home, particularly when the evidence shows that there's a strong correlation that the kids who are most at risk for violence or rejection or strong negative outcomes at home are the ones who are most reluctant to be coming out at home. And please don't claim to be protecting women or children by any of these measures, which measurably endanger them. So I want to end on a spirit of hope. Sarah McBride has a recent interview, I think it's November of 2024, with David Remnick, a New Yorker podcast. I've listened to politicians for 50 plus years, and I don't think I've heard a single interview where a politician came across as so intelligent, so poised, so psychologically astute, so full of compassion, and a model of hope for working together to make this a better country. So listen to that podcast. That's all I have to say. Stay healthy, stay happy.